Cuba, a land roughly 1,300 miles away from Lexington, Kentucky. According to the World Factbook, Cuba is roughly the size of Pennsylvania with a population of roughly 11.2 million people. Cuba is a communist state currently headed by General Raul Castro. Cuba is also notoriously known as the country in which the United States has an embargo upon. While the negative propaganda towards Cuba is very prominent, there are actually many wonderful aspects of the country that most don't know about, specifically their healthcare system.
The Cuban healthcare system could be considered one of the best in the world, especially considering the resources they have available. Since Cuba is a communist state, their healthcare is provided by the government. According to Britannica, all health care is offered through the Ministry of Public Health at little to no cost to the general public. Because of the U.S. embargo, the Cuban healthcare system appears extremely different on the surface, especially in the means of technology. However, it's arguable that Cuba has an even better healthcare system than the U.S. A report done by the World Health Organization shows that Cuba far surpasses every other Caribbean country in areas such as life expectancy and measles immunization rates of children. Cuba has much lower mortality rates of infants and children under 5 than other Caribbean countries as well. The report also shows the gaps between the U.S. healthcare system in comparison to Cuba's. Cuba has a significantly smaller prevalence rate of HIV than the United States. This aligns with the emphasis Cuba places upon preventative care and the use of contraceptives. Cuba also has lower neonatal mortality rates than the United States. This report really shows that Cuba's healthcare system more closely aligns with a first world country such as the U.S. than with the other third world countries in the Caribbean.
According to socialmedicine.org, Cuba has one of the lowest doctor-to-patient ratios in the world, meaning that healthcare is much more accessible than in the U.S. The United States has a doctor-to-patient ratio of 1 to 396, while Cuba boasts a ratio of 1 to 155. Also, according to the same website, Cuba has one of the largest medical schools in the world. Students attending the Latin American School of Medicine come from numerous countries spanning the globe. Students who attend this medical school also attend completely free of charge. This is a major positive aspect of Cuban government. The students from this medical school entering the workforce have proven time and time again to be very qualified health professionals and even more qualified than some physicians produced from U.S. medical schools.
Our group had the pleasure of interviewing Peter Barris about his experiences with Cuba and their healthcare system. Peter is a longtime professor and faculty member of the University of Kentucky. He's traveled to Cuba among many other countries around the globe. He's very familiar with multiple international healthcare systems, especially Cuba's. Our interview with him offers some unique perspective to an otherwise mysterious country.
Well, I think the single biggest strength, of course, is the general health of their population. It ranks up there with ours. It surpasses ours in most categories. But it competes with virtually every other advanced developed society's medical care system in terms of the quality and the breadth of well-being or wellness in Cuba. The biggest weakness, I think, has a lot to do with us in the United States' embargo on Cuba. So I've already outlined the absence of a lot of important medications, the absence of advanced technology, and maybe even the absence of the benefits of Cuban physicians studying in the United States and getting specialty training in the United States. We should move more towards a preventive care system as opposed to let's take care of it once it's become a serious problem. I think that we need to reconsider the balance between healthcare as a human right and healthcare as a profit. Is that education is free in Cuba. And so anyone who aspires to be a physician or anything else can in fact achieve that status. So how we in Cuba could collaboratively do so much in the world. How many healthcare issues could we address and maybe even overcome throughout the Americas, throughout the Caribbean, throughout Africa, if we and Cuba work together. And so the biggest weakness to me is what the world has lost because of this silly infighting that's taken place over the last 55 years. Lose my train of thought here.
It's okay.
Hi, Karen. How are you?